Having generated our pickup slip in the previous video, we can now make our way to the blood bank to collect the unit.
Hi, I need help with using the kiosk to take blood out of the fridge. Can you show me how to do it?
Sure, I can help you with that. The first thing you need to do is log into the kiosk by scanning your 4-digit barcode. Only after you have completed your training will you be issued with a 4-digit barcode which will allow you to scan using the kiosk barcode scanner. Then you will need to enter your passcode. You've got 3 options to choose from: taking blood out or putting blood into the fridge. There is a third option which will be covered later in the training. It handles emergency units. We're going to choose the taking out option because we want to take blood out of the fridge.
Okay, got it. What's next?
The kiosk will ask you how you want to transport the unit. In most cases, it will be room temperature, so choose that option. Choosing the room temperature option gives the user 30 minutes before the transfusion can be safely started. Please note that the cooler option is for use only by the lab staff when blood is being transferred to another hospital with the patient. Then, scan the pickup slip to know which units you want to take out of the fridge.
And then what will happen?
The kiosk will show you the units on the screen, and it will open the fridge door. The blood will be stored in the fridge dependent on the patient's surname, with each shelf covering a range of the alphabet. Remove the unit from the fridge and move the compatibility label to reveal all the barcodes on the bag. Careful, the kiosk will be asking you to scan the unit number, but first you must do the essential safety checks. Begin by checking there are no defects, clots, or leaks. Then check that the unit is within its expiry date. Check you have the right component type. To do this, you should check the type of component on the transfusion therapy chart matches the actual component you are collecting. Then, check that the donation number on the unit is the same displayed on the screen and the attached compatibility label. You will need to check that the patient details, their name, date of birth and NHS number, displayed on the attached compatibility label, matching the detail on the collection slip and transfusion therapy chart. And finally, if any special requirement are indicated on the transfusion therapy chart, check these appear on the unit product. In summary: 1. Ensure there are no defects, clots, or leaks. 2. Is the unit within its expiry date? 3. Check the type of component on the transfusion therapy chart matches the actual component you are collecting. 4. Is the donation number on the unit the same as the attached compatibility label? 5. Are the patient details, name, date of birth, etc., on the compatibility label, matching the details on the collection slip and the transfusion therapy chart? 6. If any special requirements are indicated on the transfusion therapy chart, check these appear on the unit product. Here is another key message. Along with the essential checks, some blood units or products also require additional checks. For example, red cells requires you to check the blood group compatibility table. By scanning the donation number barcode, you are electronically signing to say you have performed the necessary checks. Covering all the barcodes, except the bag unit number, scan the bag unit number using the kiosk barcode scanner. On completion of this, a good message will be sounded by the kiosk. The kiosk will ask if you want another unit for this patient. In this case, we only want 1 unit, so we are going to say no. The unit is now ready to be taken up to the ward or clinical area.
That sounds straightforward enough. Thanks for showing me how to do it.
You're welcome. Remember to always perform the essential checks and scan the correct barcode to avoid any errors. And if you have any questions, don't hesitate to ask.